Welcome, everyone. This is the Progressive Mind Show. We are glad you are joining us this evening. We're getting some feedback here, please. It might be Eunice just joined us. It might be from her feed. Okay, we took care of that. Welcome to the Progressive Mind Show. My name is Senna, aka Aline Cole. This is where we build our community by engaging you and I in pertinent dialogues that matter to our communities. This evening, we're going to be talking to the leaders of Ghana Community Health Clinic. Please stay tuned, join the conversation, and let's try and get this message out. Today is January 19th, 2022, and we will try and get to the subject matter in a few seconds. Captain Mike will not be with us this evening to take care of his segment due to work schedules. However, my guests are here, and we will try and get into the conversation. With me this evening, we have this fine gentleman and ladies who have been running this clinic for some time, and we want to get to it. Nancy Esrifi, Ochre Esrifi. I'm sorry, I'm trying to get it right. Nancy is here. We'll get to the Ochre, the Srifi, we'll get to that. But Nancy Ochre is here. She is the leader of the United African organization here in Chicago. She will tell us the part that she's playing, or her organization is playing, in this community clinic thing that has been ongoing now. We'll go straight to Dr. OFORI, who is the pharmaceutical director for this clinic. He also holds PhD in pharmacy. We would have him tell us a little bit more about himself. Dr. OFORI is not a stranger to community work, at least in the city of Chicago. Dr. OFORI also has appeared on several platforms trying to share very important health issues. Dr. OFORI, you're welcome to the Progressive Mind Show.
Thank you very much for having me today, and the rest of my colleagues on here. We will definitely update our listeners on some of the things that we've been doing. Again, like you rightly said, my name is Edward OFORI. I'm an assistant professor of pharmaceutical sciences at Chicago State University. I've been, mentoring a lot of pharmacy students and healthcare professionals. And currently, we want to reach out to the community to be able to provide the services that we render to people in the clinic that we will be talking about today. So thank you very much for having me.
My pleasure. And then next to Dr. OFORI is Nancy Ochre. Nancy, is C free or Esrifi?
No,
it's a middle name. I'm trying to get it right. Just help me out.
No problem. I know that the Fantis have a Sylphy, but mine is Esrifi. Esrifi Ochre.
Okay, nice. Nancy, of course, we all know you are the leader of the director of the African organization. Apart from that, if anything else that you're involved in, please feel free to share.
Thank you for having us here this morning. United African Organization is a coalition of African community organizations, and very happy to partner with the Ghana National Council on this Ghana Health Clinic, and so really happy to be here with everyone. Thank you, Senna.
Really, my pleasure. And see, Nancy is used to holding meetings in the morning. So I'm sure she's been on virtual meetings all day. So she's taking 6 p.m. in Chicago to morning. It's evening. So just a quick correction. But Nancy, thank you so much for that introduction. We got Dr. EUNICE CROMWELL, who is very familiar with everyone here, at least in the city of Chicago. Dr. EUNICE, you're welcome to the show once again. Okay, looks like we have a call coming in. Doctor, but you can go ahead. Dr. EUNICE CROMWELL.
Good evening. My name is EUNICE CROMWELL. I am.
Yeah, we're getting a little bit of lags, but okay. So let's go to Dr. Prince HODOGBEY. Dr. Prince HODOGBEY is the first time on this show. Dr. Prince is a family medicine practitioner. and also a medical director for the Ghana Community Health Clinic program that's currently ongoing. Dr. Prince HODOGBEY, anything else that you would like to share with the community? I'm sorry. I think you were muted for a second, but you can speak now. We can hear you now.
Okay. Good evening, Alinko, and good evening to your audience, and thanks for having us. As you said, my name is Prince HODOGBEY. I am a family practice physician. I've been in the Chicago area for a very long time, and we started the Ghana Community Health Clinic some late last year. For the help of the Ghana National Council and the Ghana House Incorporated. Our goal, as some of you might have known, is to serve the community, especially those who do not have health insurance or any form of coverage that will help them access healthcare in the Chicago area.
Okay, thank you so much. We will get to that's why we're here. We want to know what the Ghana Community Healthcare Clinic is all about, and but firstly, we wanted to know who you are. Of course, our audience would like to know who you are and what you do. Okay, so are you guys getting echo when I speak?
Initially,
No, we
but
hear
now
you.
I think it's stable.
It's fine. Okay. Dr. EUNICE, are you getting echo from my end?
Oh, not anymore.
Okay. So good. I think we have it all situated. And you didn't get a chance to say hello to the viewers this evening. Whilst you do that, Nancy, Dr. OFORI, Dr. Prince HODOGBEY, you can all share the feed from the Progressive Minds page so that your friends and family can follow the conversation this evening. Nancy, no, Dr. EUNICE, would you want to say a few words to our audience this evening before we begin the conversation?
Sure. Good evening. My name is EUNICE, business manager of the Ghana National Council. I'm very excited to be here to talk about the community health clinic.
Thank you. Now let's get into it. How long has so if we want to get it correctly, Doctor, I know the three of you, but I'm sure there are other people. Are there other directors of this program, or would you say the core of this program is the three of you on this show right now? If there are others that you want to recognize, please, Dr. EUNICE, I'll have you do that.
So yeah, we have Dr. Jamila Okon. She is actually the assistant medical director, and she's an OBGYN. Mm-hmm. And then we have Dr. Habiba. She's in charge of educational services. So it's the five of us in terms of management, mm-hmm. but we have a lot of volunteers, nurses, other auxiliary staff that help us to get the clinic going once a month.
Okay, thank you. And EUNICE, no, not EUNICE, Nancy, what role does your organization, United African Organization, play with the Ghana community? I know you said you've partnered with them, but specifically, what do you do as partners or affiliates with this program?
Thank you, Senna. So we had Dr. EUNICE recently reach out about including vaccination as part of the health clinics.
Yeah.
And so we're happy to be able to come in to make sure that vaccines are available to participants as they come in for the health clinic, to be able to get vaccinated through the day. I'm sure you know, with the coronavirus, the pandemic, and everything that is going on in our society right now, vaccinations are key to ensure that our communities remain healthy and remain ready to be here for the years ahead. And so we're happy to be able to come in and help with that effort.
Awesome. I'll come to you. I'll come in a little bit to help us understand. Are we still getting echo? No?
Yes, it started again.
It started again? Okay. We would try and see if we can mitigate the situation. I may have
I
to
think
tweak a
it's
few
better
things,
now.
but we're good now.
Yes.
Yeah, please let me know if when it comes, when it comes again, so I can, try and tweak things here, so we can get the conversation going. Um, Doctor, how long has this program been running? I don't know if Dr. HODOGBEY wants to take this, or Eunice. Okay, Dr. HODOGBEY.
The program yes, the program in terms of the community health clinic, we started in November of last year. However, there has been health screening in the Ghanaian community that has been going on for years. I think the first time I participated, if I'm not mistaken, is about 2017 or 2016. The community health expo has been going on for that long. When the idea came to establish the clinic, we realized that we already have the structure in place. Therefore, it is easier to work through the Community Health Expo that was being run by Dr. CROMWELL for many years before the clinic idea came in. So we joined hands with that since the structure was already in place. So the Community Health Clinic is started November of last year, but there was a mini version of it with Community Health Expo that has been going on for a long time.
Okay. Dr. Eunice, thank you so much, Dr. HODOGBEY, for the explanation. Dr. Eunice, I have been I've visited some of the annual health, I'll say clinic, annual community health clinics that the GNC has been organizing in Chicago. Um, how different is that from the clinic that you are running right now?
So prior to the clinic that we're having once a month, we were having the Community Health and Wellness Expo. And the expo was focused on education. It was also an opportunity to bring in vendors able to share their products. The difference between that and the clinic is that right now we are keeping a database of our patients. We have more access to follow up with them. We're more focused on preventative medicine and management. So a little bit different. As Dr. HODOGBEY said, in terms of the work atmosphere, we still run it the same. However, we don't really have the vendors and we don't have the expo feel. It's more of a clinic setting.
Is it registered as a non-for-profit, privately owned? Who controls it? Let's help us understand the legal structure or setup of the clinic.
So the clinic as it stands right now is with the National Council.
For me or Dr. CROMWELL?
Well, she started, so let's have her continue.
Okay, sorry about that. So the clinic as it stands is under Ghana National Council and Ghana House Incorporated. So it's non-for-profit as it stands right now. Nobody gets paid. It's strictly on volunteer basis. And as we continue to grow and expand, our hope is to turn it into a federally owned clinic. But we have a lot of future, but as it stands right now, it is just a non-for-profit clinic.
Thank you. I think that hopefully the feed from your end will be clearer. I'm sure that there's a little bit of internet or technical challenge from that end, but I'm sure it's because of your area where you are. Dr. HODOGBEY, would you want to add a little bit to what she said in terms of the setup? Because from what she said, I take it that GNC, the Ghana National Council here in the city of Chicago, from the yearly health program that they've been providing the community, decided to move it a notch further, so now it's called a clinic. And if that's a simple explanation to it, that's fine, unless you want to add anything else to it, Dr. HODOGBEY.
Yes, that is the simplest explanation to it. There is an addition to that. in that the Ghana National Council, we all know, or those of you who don't live in the Chicago area, is the umbrella group of all the Ghanaian associations in the Chicago area. So the Ghana National Council set up Ghana House Incorporated to look into ways of acquiring Ghana House for the community, for the Ghanaian community in the Chicago area. And then in the process of doing that, the idea came in to add a clinic to the Ghana House as a way to provide services to the people in the Ghanaians and general public in the Chicago area. And that is where the clinic came to be. But as I said, it is in conjunction with the Health Expo that has been going on for a long time. So the clinic was just folded into, or the Health Expo was folded into the clinic for ease of running and not going into duplication of efforts in terms of how we service our people. As Dr. Cromwell said.
Mm-hmm. No, I'm sorry. I'm listening. I thought you had ended your statement.
Yeah,
But please go ahead.
Okay. As Dr. I think there's a delay. So as Dr. Cromwell said, the expo has been there. That was the genesis of how this came to be. So I know there is a confusion in the community, and we have to clear that today, especially those in the Chicago area who are listening. Our people tend to dwell so much on whose idea it was, more so than how the program will function. To me, whose idea it was doesn't matter, because you can have all good ideas in your head. If you don't make it materialize, it just remains in your head. So I will caution, especially those of us who are listening, that we should stay away from the turf wars and focus on how best we can set up this clinic to serve our people well.
Thank you so much, Dr. OFORI. You have, I know you haven't, coming in yet, but how long have you been part of this health clinic program? I know for both for the yearly program and now the monthly program. I'll say, as of course, now you are part of the monthly program. So since it started as a yearly program, how long would you say you've been part of it?
Since its inception, I've been part of it. I think in the beginning, it was mostly the Ghana Pharmacists Association of the Midwest. We were invited to most of the annual expo programs. And during that period, we kind of, saw that there's a need in our community to actually have something that is, some kind of regular, instead of an annual, exposure to that particular event. Right. So, going forward, when EUNICE and I and the rest of the team talked together and realized that, we can actually do more for the community. And that's the reason why we decided to join. So most of the time, I still bring the Ghana Pharmacists Association group alongside to increase participation.
You said the National Pharmacy Association.
The Ghana Pharmacists Association in the Northwest, the Midwest, and also the national body. I happen to be the vice president, and we used to go to most of the events for the annual expo, and through that we realized, there's a lot of demand for health needs, as Dr. HODOGBEY and Dr. Cromwell already mentioned.
If you say health demand, a great point. Do you realize these health demands only within the Ghanaian community, the African community, or generally just the minority communities? You can respond to that, and I'll have the other panelists respond to the same question, please.
Okay, great. So that's a very good question, in the sense that, as you all know, in the event of this pandemic, we've realized that our healthcare system, especially in the United States, suffers for a lot of disparity in terms of healthcare delivery. Also, we do see that there's a need to embody some equity in the way that we give healthcare needs to people. So, in particular to the African community, and I know Nancy can speak to that, there's a huge demand because most of us are immigrants coming from Africa, and because of certain socioeconomic predispositions or cultural predispositions, we don't tend to seek medical help in that regard. And some of us don't have health insurance. So these all, culminate into some of the things that we see statistically, that we don't tend to see a lot of people seeking help in terms of health among the African community, minorities in general, and therefore that has affected the way we do when we get any kind of sickness.
Right. How long have you been practicing? How long have you been a pharmacist in the city of Chicago, in the state of Illinois? Sorry.
So I'm not a practicing pharmacist. I'm more of a researcher and educator. I'm a registered pharmacist from Ghana. I've had a passion to always connect research and health in that regard. I mobilize people. I mobilize my students to be able to give to the society, because whatever you have is not enough. You always have to encourage people to give back to the society that actually helped them. So this is one area.
That's very beautiful. You were practicing in Ghana, but here you prefer to do more research and teach there. Correct. To practice. It's practicing boring? You just it's there in the booth and you deliver. Is that boring reason why you want to do research?
No, it's not necessarily, but because I practiced for some years back in Ghana, but I just felt it was another niche that I could potentially fill in. And since I moved into that niche, before you take that medicine that you swallow, you understand that there's a lot of work that goes into it, right? So I just wanted to be part of that work behind the scene, right? And in developing drugs and things of that sort.
Developing drugs. Well, thank you for sharing. I was going to take you into the vaccine conversation, but maybe we'll go down there during the conversation, during the show. So thank you so much for sharing.
No problem.
Nancy, UAO, for people who are watching for the first time, United Africa Organization, you are the director, you lead the organization with all the awesome job that you do. What exactly, if somebody hears the name, what would you say should be that one or two sentences that should pop up in their head? What are you affiliated with, in terms when it comes to your organization?
So I would immediately say that it's the go-to place, the one-stop place to gain a better understanding of the society and try to figure your way and path as you go. UAO was started a long time ago by our community organizations. Many of them were here, realized that they were still here, and thought that it was important for them to have this organization, United African Organization, that really serves as a voice for the diverse African community, especially around public policy advocacy and also provision of services that the community really needs. And so that is who we are, to be there, to be a bona fide support for the community and get us empowered and keep us going.
How long have you been, has this UAO been in existence in the state of Illinois?
So the idea of the United African started 35 plus years ago, but the office and the services have been in existence for about 18 years.
Okay. Thank you for sharing. How long have you headed this group? This organization?
I am new. I think this is my 2018. I'm thinking it's 3 years, but it's probably more than that.
Okay.
Yeah.
Having taken charge of you, what are some of the main challenges? And I think echo is coming back, right? You guys are getting echoes? Are you guys getting echoes? Are you guys hearing the echo? Okay.
I think I'm okay.
Dr. HODOGBEY, do you get me, Dr. Eunice, do you get the echo when I speak?
Yeah.
Okay.
Maybe Nancy can go and come back because I think she
Yes.
has it open twice on her computer.
I was suspecting that. So
Yeah.
I had a follow-up question for you, Nancy, but please, if you can help us, you can just sign out and then try coming back in, okay? Actually, let me see if I can help her out here.
Yeah.
Okay. Thank you so much, Assistant Producer Dr. Edward OFORI, for helping the technical issues. Much appreciated. So we've had the idea of the Ghana Community Health Clinic being run. I mean, the Health Expo has been going on once a year. Now we've moved into a monthly program. So this is the February will be the third month since we started the monthly program. Eunice. Dr. Eunice,
Yes,
can you hear me?
Yeah, I can hear you. It's going to be the third month. Yes.
Okay.
February the 12th.
Okay. Is there a particular location that you host this event consistently, or you move around the city of Chicago?
So our first idea was kind to make it like a mobile clinic, but we have partnered with the Presbyterian Church of Ghana, the Redemption. That's on 87th Street, and they were very willing to allow us to use their space for the clinic. So that is our permanent space for now.
Let's see if we can get Nancy back. Okay, so I think she's trying to get her camera on. Right, Dr. HODOGBEY, you being okay. So you are the medical director of this program. What's the outreach strategy like? Do you normally get the word out through other community leaders in the minority communities, in the African community, or how is that approach being looked at the moment, getting the word out for this program?
Yes,
okay.
the dissemination of information.
Yeah,
yes,
we can hear you.
The distribution of information. The distribution of information is multiple-fold. We are community-oriented, so we have the ethnic associations in the Ghanaian community in the Chicago area. So the Ghana National Council helps us to distribute and disseminate the information to our potential patients through the ethnic groups like the AB Association, the Ghanaian Association, the Fanti Benevolent Association, the Santima Association, the Kauman, and all the ethnic groups in the area. And then we also put in a lot of effort to, we have flyers that are being distributed in barber shops. Dr. OFORI is helping a lot with that, and also some of the residential, the high-rise residential buildings that have a lot of Ghanaian occupancy, and also some of the grocery, the Ghanaian and African grocery shops in the entire area, the suburbs and the city, and also the electronic distribution, and also programs like yours. We have other programs in the community that do the same thing that you are doing now. So the goal is to get to as many people as possible, because that has been our hindrance up to this point, not getting the information to as many people that will need our services.
Thank you so much, Dr. OFORI. I see you nodding your head. Anything you wanted to add to that?
So I just wanted to stress that one of the things that we want to do is to reach as many people as possible.
Yeah.
So that those who can take advantage of it can do that. You and I know that healthcare is not cheap in this country, right? We are offering it for free. We're offering our services for free, and therefore we want everybody to take advantage of it. So we encourage a lot of our listeners At least there are about 12 different occasions that you can do that. Every month we organize this. So within the year of 2022, at least make sure that you come through and have your screenings and health checked, your medications looked at in terms of that sort for free.
Awesome. I was going to that exactly what you provide there, and so thanks for taking us there, bringing that point up already. Nancy, can you hear us now?
Yes, I can.
Okay. Looks like well, we're still getting the echo because I can hear myself, but it's okay. I think we'll make it happen. I was trying to get from you some of the. I think I may have to get back to that question, but you talked about some of the things that you provide the community. I was going to ask you what's the jurisdiction of your activities? Would it be just the African community, or you target minority communities, or just open to anybody that walks through your door?
Our target population is really African immigrant refugee communities.
Okay.
We expand that to the larger Black immigrant community, but anyone who walks through our door gets served. Yeah.
What has been the major challenge or the major need of the communities and the people you have served from your experience?
I think that there are many things as Africans that we like to not talk about. Our immigration status is one of them.
Okay.
But it is an important component of our lives as we live and try to thrive in this society. And that is a big issue because it impacts your access to healthcare, your access to education, and your ability to sustain yourself and really live successfully in this country. And so immigration is always number one. We do a lot of immigrant rights advocacy and work around that, helping people gain access as well as advocacy around immigration.
Okay, so immigration is number one. You mentioned that as a result of the challenge of immigration status, it can hinder someone from getting healthcare. Would you say that this issue of healthcare, accessibility to healthcare comes up a lot, and is the main reason why we're working with the Ghana community?
Well, as humans, right, our health is important. And so for us as an organization promoting opportunities that help us to live and have good well-being is important to us. And so for us, we've done research in the community. We also do education and also help with access to healthcare as well. I think that there are many barriers that our communities face, and immigration status is one of them, but there are other things like language, an understanding of the culture that is in this society, the healthcare system, how things work. Right now, we have a lot of people who have all of these bills that they need to pay because they've been to a healthcare provider or another and are wondering, how do I work around this? And sometimes it affects, it gets people depressed, right? It gets you into a state that you ask yourself, where am I? And so many people shy away from really seeking healthcare when they need to because of some of these issues. And for us, as we, it's part and parcel of our well-being to be able to sustain ourselves here. And so it's really an important component of the work that we do.
Awesome. Thank you so much for sharing. Dr. EUNICE, have you, let's see here. Okay. ECHO has been taken care of. We know what the problem is, and we'll go to the root of the problem and solve it. Even if you're unable to solve it, we'll try and get the show going. So please bear with us. It's 20 minutes, no, 40 minutes past 6 p.m. Central Time. You're watching the Progressive Minds show. This evening, we are talking to the program directors of the Ghana Health Community Clinic program that is currently ongoing. We want to know more about some of the services that they provide, why they are doing this, who they're trying to reach, and all of that. So feel free to be part of the conversation. We are currently live on Facebook on our page, Progressive Minds, also live on YouTube, The Progressive Mind Show, and as well as Twitter, The Progressive Mind Show. Again, we encourage you to participate. You can ring in and share your opinion, share your ask questions, regarding your health. We have 3 doctors on this show. One is a pharmacist. So feel free to ask all questions that you may have. 815-277-5047. Dr. Eunice, what have you had challenges getting volunteers into this program?
No, I would say that we've been really, really blessed to have a lot of volunteers. There are a lot of nurses that reach out and tell us when they can work. Also, a lot of our volunteers also donate services to us, and they give us supplies. So I'd like to just take this time to really thank everyone who comes to support us. There are people who donate gloves and garbage cans and everything. I think that when you see a clinic, no one understands how much work and money it takes to really get it going. So for us to be able to have this clinic, we are really, really grateful for the people who donate to us. One of our major sponsors, of course, is Mr. Rubin, who has Gold Coast. Him and Miss Rosemary, they've been beyond generous to us, and they've always helped us financially to be able to get the supplies that we need, along with Ghana National Council. So without them, we would not be able to have this clinic. And of course, without our wonderful volunteers, we wouldn't have anyone to help all of our patients. So we are really, really grateful in that aspect.
You said that it's a challenge running these. Help us understand some of the challenges that you all have to go through to make this program. Now, even more so now that it's going to be, it is a monthly program. You want to share some of the challenges? I'll have Dr. Prince and Dr. HODOGBEY, Dr. OFORI and Dr. HODOGBEY respond to that as well.
So I think, in general, just organization is always a challenge, especially when you're dealing with a lot of people. So making sure everything runs as professional as possible is something that we strive to. Of course, supplies sometimes can become an issue. That's why we are grateful for the people who donate supplies to us, and of course our sponsors. Location sometimes is an issue because it's far, and as organizers we need to be there 2 to 3 hours ahead of time to make sure that everything is organized. Follow-up sometimes can be a challenge because some people don't have access to a telephone or don't have a smartphone where we can video call them. There are language barriers, which I'm grateful that we have a vast variety of people working there that can speak the different languages, because if you have someone who can't speak the language, you think about healthcare and how you can bring yourself down to that level for them to be able to understand what you expect from them as a healthcare provider. So I would say that those are our challenges. And then participation, unfortunately. This clinic has been going on for 3 months. Prior, we were doing it yearly. Then we changed it to twice a year. And we could still use a lot more people, because there are people who personally call all the providers in Chicago and ask for medical advice. And those are the people that we want you to be our patients in the clinic. We can serve you a lot better if you are a patient and we're able to follow you up monthly and take care of you, versus you waiting till you have an emergency and calling for medical advice. Though I don't have a problem with anyone calling, but those are the people that I really want to encourage today to be part of our clinic.
Wow, thank you. Very well put out there. I think it's clear what the challenges are, but I will also want Dr. OFORI to respond if there are any other challenges from your perspective apart from what she shared.
Sure. So Eunice and I are in the same. I would say we share the same sentiments when it comes to the problems that we face. She clearly articulated those problems, and I think one of the things that we hope to achieve is that this is kind of a little new, is to be able to get the word out there through your program, your mouthpiece, and the programs that I go on, to be able to get the information out there. Sometimes it's not about just having the great things. It's about reaching out to people. So this is one area that we think we have to improve on as we go along. But I'm very hopeful that as time goes on, the Ghana Health Clinic is going to get popular and people are going to know more about it and take advantage of it.
Awesome. Dr. HODOGBEY, you want to share something or add to what they already shared?
Yes, I concur with everything that that they have said. Obviously, that is needless to say because we are a team. But I will echo again that participation. We really want to reach out to as many people as we can. So programs like yours and word of mouth and functions when people go to funerals, just let whoever is doing the announcement know, or churches know that we exist and they can reach all of us. The flyers are in the community. But the main thing, we are a startup group. So every challenge that any startup organization faces, we face. Funding is key. Now our budget, because of funding, our budget is at the barest minimum, those things that we can provide. We can have to provide a good care to people. And we are trying to reach as many people as possible. And also we encourage some of our providers in the community to come and join us. We cannot have too many because we intend to grow. So the more providers we have, we can share the responsibilities, especially in terms of follow-up on patients. Our patient population, as we envision, is going to be quite demanding, and therefore we need more hands on deck to be able to help them and service them to the best of our ability. So donations, we are welcome. Dr. CROMWELL has been helping us a lot with that, and we have to thank her a lot. And there are other things that we don't want to talk about, but people who know me know that I say things that a lot of people don't want to say. One of them is the infighting in our own community as to who brought up the idea and what. So if any of our leaders are listening, we plead with you. I always say that an idea is nothing if it is not nurtured to materialize. So we plead with our leaders to look at how we can grow this clinic to have even multiple clinics in several parts of the Chicago area, sprouting out of this one that we have started now. Let's think of how we can do that instead of thinking about, okay, whose idea it was that we are trying to grow. That doesn't get us anywhere. So I plead with our leaders to really help us in that regard. If we can get the infighting and internal wranglings under control, we are going to go very far to serve our people in the community.
With everything, the foundation is very important. If it's weak, it becomes very challenging to grow and to expand. So great point you're saying. If the internal structures, if they are infighting, then we have to be cautious. Dr. EUNICE, would you want to touch on what he just said regarding, this maybe in-house back and forth? You want to touch on that and help address it so we can move forward properly as a community, as one people?
Absolutely. What Dr. HODOGBEY said was very important. I think that internally, in terms of our healthcare team, we don't have a problem. So we take care of our patients. I think Dr. HODOGBEY and Dr. OFORI can all agree, along with Mrs. Nancy, that we don't have a problem taking care of the patients. But what he's talking about is just the misunderstanding, unfortunately, between Ghana National Council and Ghana House Incorporated, which is something that they are working on internally, because, like I said from the beginning, these are two organizations that have partnered together to bring about this clinic. So when we talk about taking care of patients and internal issues, I want to make it very clear for all of our lovely patients that are watching, we don't have any problem internally taking care of patients. Unfortunately, there are problems on the outside related to the structure of the clinic, but we are dedicated and committed to make sure those problems are solved so that as healthcare professionals, we can focus on what's important, which is preventative medicine and management.
Thank you so much for that clarification. Dr. HODOGBEY, my apologies. I think that I heard you correctly, but my question was not accurate based off what you had explained. So, Dr. EUNICE, thank you so much for the explanation. I don't know if Dr. OFORI wants to add his 2 cents to that.
No, I'm good.
Okay, awesome. So Ghana National Council, we all know how different is that from. There's a difference, but help us get a clear understanding of what Ghana Incorporation stands for and what the clear distinction is between the two. Dr. EUNICE, I'm sorry, Dr. EUNICE.
So I'm going to let Dr. HODOGBEY answer that question because he is, he's the representative from the Ghana House Incorporated. So okay. I'm business manager at Ghana National Council, and we all know what GNC stands for. He said that in his introduction. So let's let him go ahead and give the Ghana House Incorporated.
Dr. HODOGBEY, that's just Dr. CROMWELL saying, since you are the troublemaker, she wants to handle the baton of trouble. she wants to handle the baton to you. That is on the light side. That's very on the light side. But Dr. HODOGBEY,
I know. I know. If you do that again, you will kneel down on your own show. Okay. Okay. Yes, the difference is that, as I said, Ghana National Council is very well known, has been around for over 30 years. Is the umbrella organization for all the ethnic and non-ethnic associations, Ghanaian associations in the Chicago area. That is well known. And it is Ghana National Council is the mother or the father of GHI, which is Ghana House Incorporated.
Okay.
Ghana National Council came up with the idea of getting Ghana House for the community. It's a community center that will have so many ancillary services, including a clinic if everything materializes. Mm-hmm. So Ghana National Council set up this committee of people to look into the feasibility of having the community center. That is how Ghana House Incorporated came into be. It was a committee. It was a committee before, and it has been turned into a board. And so, in short, that is the relationship between Ghana National Council and Ghana House Incorporated. Yes, okay. Ghana National Council created Ghana House Incorporated to work and find Ghana House, which will serve as a community center, including a clinic, a library, playground, and a hall for parties and everything.
All of that. So okay, how is that going?
There are so many challenges, and but we are taking baby steps to get to address those challenges.
Okay, cool. Thank you so much. You were watching. It's 53 minutes past 6 p.m. Central Time. We will be getting into the specific services that they provide during these clinics. And so please, we encourage you to pay attention and to ask questions as we go along. Now let's get into the very fine details. Somebody hears about this program and visits the clinic the first time. Can you walk us through the procedure, please, Dr. CROMWELL, Dr. EUNICE CROMWELL?
Sure. So when people first come in, what we first do is we give them some registration paperwork. Mm-hmm. Amongst that registration paperwork is a waiver that they're going to sign. We're going to be providing them with medical advice. We can also give them prescriptions for their medications. And we are all binded by HIPAA, which is a protection not to share personal information about patients. So we make sure that they understand that. Stage one is going to be getting your height and your weight so we can calculate your BMI. Then you'll go get your blood pressure checked. You'll go get your blood sugar checked. And then if you need healthcare insurance, there's a lovely lady we work with, Miss Linda. She's a benefits specialist, and she'll be able to help you apply for Medicare or Medicaid. And she'll go through that process with you. Then our other station is going to be Dr. OFORI, who he always comes with his pharmacist. And his role is to make sure that everyone is understanding everything about their medications. So they do consolidation of all your medications, and they can also provide you with discount cards for your prescriptions. After you do all that, you're going to go and see a provider, which would more than likely be either Dr. HODOGBEY, or if it's for women's health, Dr. Jamila, Dr. Habiba, myself, anyone that's available will see you, and they will review everything that was captured in your intake, and they will do an assessment on you. If there are medications to be ordered, those medications will be ordered. Dr. OFORI is always available to provide extra information about the medication, interactions, or anything that you may have. And that ends all the series that you have to go through. But of course, we are always available to help people. If someone had a very high blood pressure, we would keep that person back and recheck their blood pressure. Our goal is to make sure everyone leaves there stable. So if someone's starting a new medication, we really take our time, make sure they understand how to take their medicine, answer any questions or concerns that they have, and of course, give them their follow-up appointment, which will more than likely be monthly. Now, we have had a couple instances where people are unable to come to the clinic, and those people are seen in their homes, or they're seen through telemedicine. And Dr. HODOGBEY, being the medical director, oversees all these things. And so that you can be rest assured that if you can't come to the clinic and myself or Dr. Jamila or even Dr. Edward need to call you, everything will still be just like you're in the clinic.
Wow. Are there other providers or other organizations that are similar to yours in the city of Chicago that are already doing this? Do you guys, anybody has any information on this?
I think the Asian Health Services, if I'm not mistaken, they kind of started off the same way until they turned into a federally owned clinic.
Okay.
So I think, and then even the Indians have their own clinic. So I think that we call it the Ghanaian Community Health Clinic because I believe charity begins at home. But of course, it's open to everybody. Yeah. But we, because we are Ghanaians, we want to make sure that the Ghanaian population is doing well. I also think that with COVID-19, one thing that Dr. OFORI and I thought about when everybody had so many questions was to just provide an outlet where people could ask questions about the vaccines and everything. So coming from there and then having the clinic, it just makes more sense to start with the Ghanaian population because we're thinking about, we want to have Ghana Fest, we want to see each other, and how do we make sure we do that? We need to get more people vaccinated, and that's where Miss Nancy comes in. So that is our goal, to make sure that our community is strong and our community is healthy. And I think if people watched our interview on the news, one statement that Dr. HODOGBEY said that really sticks with me is that, more people that come here would be the reduction of him having to attend funerals. So I think that concept is very, very important, that we are here for the promotion of life and the promotion of health.
Can you repeat that statement again? Something about funerals?
Yes, he said that with the clinic, the more people that come to the clinic, the more lives that he can save, and then that would make the less funerals that he would have to attend.
That's very powerful. That's very powerful because we've been hearing of a lot of sudden deaths in the city. In the city, I say last year up until this year. Nancy, if you have statistics on number of deaths within the Ghanaian community, or the African community, or even the diaspora community, can you share with us? We know a lot of people have passed, but again, if you have stats, fine. If not, can you share with us some of the, death issues deaths that has gone on in these communities per you're working with the people on the ground and health professionals like these guys here?
Yeah, Alenko. We did ask the Department of Public Health for statistics, but they were not tracking it in that detail at the beginning. We can ask again to see if it is being done now and if we can have any statistics. But there have definitely been people in our African communities that have been impacted, lost lives. not to talk of how many people have contracted COVID and have, suffered as a result of this. And so I think it's important, right, for us to work on health promotion and promoting the well-being for each and every one of us.
Thank you so much. Dr. HODOGBEY and Dr. OFORI, if you had any comments that you wanted to make whilst on the procedure or how we and the services that you provide during this clinics, I'll have you say that in a little bit, but I want to follow up with Nancy a little bit. How has the vaccine conversation how has that been going with the people that come to the United Africa Organization for various services? Are they responding? Are they taking it? And how is it affecting, the community in general, again, from your working experience and whatever data that you may have collected?
I would say that for various reasons, right, there are many people in our communities that are reluctant to get the vaccine, and for many valid reasons, because of, things that have been said. I know that sometime during the pandemic, there was a French doctor that came out openly to talk about using Africans as guinea pigs for the vaccine. There are many people who are reluctant because of religious reasons. And there are many reasons why there are people who will not get a vaccine. But I think it's important for us to continue to, as Dr. HODOGBEY said, and Dr. CROMWELL just repeated, to save more lives, promote health, and avoid more deaths. It's important for us to continue to provide these opportunities for our people and to get them to know that, when we get tetanus vaccine and all of these polio immunizations, we don't question the components of these. And this is happening in our lifetime. And so there are all the questions that are happening around them. But we need to understand that when years later, our children come back and ask us, what did we do and how did we survive? That we have the right answers for them. And right now, vaccines are the right thing to protect each and every one and to ensure that we remain here for the next year and the years ahead of us to, survive even when you get this COVID-19 virus. And so it's important for each and every one of us to think about it. And if there's any reason why we are hesitant, come out and voice it out and get those questions addressed so that we can all protect ourselves and the loved ones and the people that are around us.
Thank you so much for sharing. You may not have the data, but based on the number of people that you serve on a weekly basis, monthly basis, how many have you personally heard that have caught COVID or passed away? Can you put it in a rough percentage wise for us?
We are not tracking how many people have COVID. We are asking people how many, if they have taken the vaccine or not. But I'll say that one of the other things that we are doing as an organization is being part of Rebuilding Back. We are helping people who get COVID by connecting them to resources. And we see so many people who get COVID, and we see the effects and the devastating effects it has on them. It goes round from mother to father to children. And, with the quarantine time, that length of time it takes for it to move from one person to the other, it could take months before the household really recovers from COVID-19.
Yeah.
So those are some of the things, the impact that it has on people who get it and how we help them to be able to survive during that time.
Let me pin you to the corner a little bit. How many have you personally heard that have caught COVID-19? I'll say from last year up until now.
In the last few months?
No, from last year up until now. How many people that have you heard? I mean, maybe 5, 10? Can you put a rough figure to it?
I won't put a number, but many of them. I think that right now I know maybe 10 or more people who have COVID.
Okay. How about people who have passed away?
In our community, I personally know 2 people, actually 3, that have passed away as a result of COVID.
Okay. Thank you so much for sharing. I was going to go to Dr. OFORI for the vaccine comments, but I think we lost his feed. Hopefully we can get him back. Dr. HODOGBEY, before you comment on the services that you provide, how many personally? I personally have heard, at least from the Malian community, a friend of mine, Fatima, we talk all the time, at least 3 from the Malian community, if I'm not mistaken, could be 4. So yeah, people have really fallen to COVID, and this is very, very serious. So this conversation is super important. What the Ghana Community Health Clinic is all about is very, very critical. They're not only serving the Ghanaian community, they are open to anyone who needs health service and cannot afford it. If you don't have insurance, you can go to the hospital. You can always fall on them. Every month now, they're having this health clinic going on in their community. So it's the Ghana Community Health Clinic serving humanity through healthcare. Very, very powerful, very important. Dr. HODOGBEY, would you want to chime in on this? How many people that you are a family medicine practitioner? So I'm sure you've heard a lot of deaths. You've seen people pass through your hands and all of that. Can you give us some stats or maybe some numbers that you have heard in the Ghanaian community or the minority community in general? Dr. HODOGBEY.
Excuse me. Yes, the Ghanaian community, you know us, we are very secretive of everything we do, especially when it comes to healthcare. But Ghanaian community, if I limit myself to the Chicago area, at least 4 or 5 people confirmed that I heard of that have passed away from the disease. Definitely, we are larger than that. The number will be higher than that. But those ones that can come to mind in the Ghanaian community in Chicago area, at least 4 or 5 people that I heard of. In personal experience as a physician, too many to count. In terms of people who I know or acquaintances who are either a friend of a friend or very many. And some so dear because in my view, they were too young to go at that time. So the impact of this is nothing to play with. We plead with everybody to really get. OFORI is going to talk about vaccines, and Nancy has eloquently spoken about that. We cannot take this as a joke, because it is unfortunate that this issue has been politicized from the beginning, and then the anti-vaccination groups have become so loud with misinformation and, in most cases, disinformation to put fear into people who will get this vaccine. This vaccine has been around for some time now, over a year now. And I think at this time, billions of people have received at least 1 dose of the vaccine. So with that many numbers, any of the serious side effects of these vaccines should have been out already. And yes, no medication, even Tylenol, has side effects. So I will not say that the vaccine is foolproof in terms of side effects. No, it's not. But it is not what the anti-vaccine groups have made it to be. And I will plead with everybody who is listening now, if you are more than 5 years old and you have not received the vaccine, please do that. The most ironic situation that we find ourselves in is that this vaccination has been actually more criticized than most of the vaccines that we have been getting already. The efficacy of this vaccine is higher than most of the vaccines that we have been getting already, and nobody complains about those. And the irony that I was going to talk about is that the same pharmaceutical companies who made these vaccines are the same pharmaceutical companies who are making the medications for the treatment of COVID. But people are rushing to those medications and then leaving the vaccinations. And that is the irony that I cannot put my head around. That the same companies that make the vaccines are telling you it's good, you don't want to listen to them, but when they make the medication, that when you get the disease, you can take them, you run to get those medications. I can't put those two things together. But that's where we find ourselves, is because of this information that has been put in the entire world. It's not only in the Ghanaian community, but we are talking about Ghanaians. So that is where we will put things and plead with our people, plead with our colleagues, plead with those who are listening to you. If anyone is on the fence, if you still have questions, you have our names here, you don't have our numbers, but you can contact the host, you can contact us, and we'll walk you through some of the misconceptions about these vaccines.
Thank you so much for sharing. Dr. OFORI, before you come in and respond to the vaccine concerns and some of the protocols, you want to take a quick break. When we come back, the conversation would continue. It's 10 minutes, 12 minutes past 7 p.m. Central. You're watching The Progressive Mind Show. I'm your host, Alinko. When we come back from the break, there's a very exciting news that I want to share. We want to grow, and we are taking the steps to get there. And so we do have an exciting an announcement that is coming to the Progressive Minds. We're very, very, very excited about it. We will share it when we come back. We'll also hear from Dr. OFORI right after this short break. 30 minutes past 7 p.m. and we are talking to the directors of the Ghana Community Health Clinic program that is now ongoing on a monthly basis. We will share exactly where the location is at. Please take advantage of this. If you don't have health insurance, or if you have any concern about health issues, this is free of charge. They also have a lab. They can give you they provide lab services, right? We'll have them talk about that in a minute. But the announcement that I wanted to share with you is that we're going to have a co-host. Okay, it's simple. It's not like for those of you who are expecting that, hey, something bigger than what I just said. But for us, okay, this is huge. Reason being, we have been on this journey for what, at least 4 years now. We started in 2017. We were at a traditional radio station. We moved from there, went to another traditional radio station, and then COVID hit. Then we decided to do it on Facebook and on YouTube. It's been a tough journey, and you have come to associate the Progressive Minds with this guy right here. but the job needs a lot of work and support, and we need different perspectives based on where we're going and what we want to achieve. And so we are glad to announce that in beginning next month, our new co-host will be joining us, a very powerful, knowledgeable lady in the city of Chicago who knows the city very well, and understands some of the issues and has a heart above all. That's the key thing. This lady has a heart for community work. She has a heart for people, and that is what we look for on this platform. And so, stay tuned. We'll be seeing the flyers on that very soon. But yes, we're very excited to be sharing this information that the Progressive Minds is not only going to be Alinko henceforth, it's going to be Alinko and the co-host. The name will be shared very soon. But let's go to Dr. Ofori to share with us. Dr. Ofori, people have been talking about the vaccine conversation versus for and against is a no-brainer nationwide, globally, I guess. But let's limit ourselves to the clinic that you're running, and from your experience working with people, the concerns that this vaccine is not right, it's not good, it was made to kill us, and all of that. Do you hear this every day? And is this the main reason why people don't want to take it? If that's the case, what can you say to help diffuse people's minds, as at least those who are willing, who are open to hear why they should take this vaccine?
Thank you very much for this opportunity to talk about vaccines and why they're very important. I think we already acknowledged that. One thing I would say is that, especially when it comes to infectious disease, there are two ways you can get some kind of prevention. It's either you get it from getting a vaccine or you get it from the virus itself.
Mhm.
The only difference is that in most cases, the virus itself or the bacteria or whatever you're getting the disease from can potentially kill you, and the vaccine doesn't. And we've seen that with COVID-19 vaccination. We haven't registered even one death that I know of as a direct result of you getting injected. The only thing is that it's more about, like this thing's being politicized, as Dr. HODOGBEY mentioned, to the extent that people are more worried or it will intentionally get infected to get the immunity or whatever they think they will get than to get a vaccine itself, right? So the difference is, and Dr. HODOGBEY mentioned that this same company, especially Pfizer, the same company that made Viagra is the same company that is making the the vaccine, right? But people will gravitate towards other medicines that are made by the company that doesn't trust it anyways, J&J or whatever, but then they will not go for the vaccine. The reason is vaccines are used for prevention, right? You haven't gotten the disease yet, so your perspective about health is a little bit different, and you have the luxury of just just saying that I don't want to have it. But if you had something like Ebola, I'm pretty sure a lot of us are going to probably get vaccinated by now. Like it will be 100%. There will be no hesitation about getting any kind of help. Second, we are in this country. Most of us get flu vaccines, right? Some of us don't. But flu vaccine has about the maximum that we've seen with flu vaccine is 60% efficacy. But every year, people go to the pharmacy to get a shot, right? So the newness or how new this whole vaccine is a component. Second is the fact that, especially among Black communities, we don't really trust the healthcare system. One of the problems that we do have in America and other countries is the fact that we don't trust the healthcare system. Even in Ghanaians, we will trust some herbal mixture compared to the healthcare. When I used to practice in Ghana, you have people come to the hospital almost at the end of their life, right? It's because you probe further and you know that people are not seeking preventative medicine, but they're rather waiting to the last minute. So I think going forward, vaccination for COVID is very important. There's been a lot of talk about whether it's efficacious, what the intent is, and all of that. But it's clear unequivocally that at least 80%, more than 80%, close to 90% of individuals who are vaccinated don't even have severe symptoms at all. And there hasn't been the margin of death among this population is really limited. So I will advocate that if you're not vaccinated and you're listening, you should go ahead and get vaccinated, get a booster shot. When you do catch the Omicron, which is spreading very widely, you have a high chance that you're not going to have severe disease.
Thank you so much for breaking that down for us. I must say that I took mine yesterday. Dr. Cromwell, thank you for hooking me up. But I look at the appointment date and I'm like, do I have to wait that long? So I made a call to I called my insurance company, and then, one thing led to the other. They hooked me up and I went for it. To be honest, I didn't even, it was like, once it was my turn, it was like a few seconds. I drove back home, sat down for 15 minutes. It was like nothing happened. I came home, nothing happened. Today, I kind of felt a little sleepy. I just wanted to sleep and all of that. But I must say that I took my, after a long debate in my head, I had to debate it for some time. But and I know a lot of people are going through that struggle. I went ahead and I got yesterday after falling sick, very sick to the Omicron variant last year, and the experience that I had, I'd rather take the vaccine and not go through that experience again. Seriously. And so, a word to the wise is enough. Dr. OFORI, I must say thank you so much for breaking that down. How many people have you heard personally in your line of service that have fallen dead to what do you call it, COVID-19?
I mean, it's a lot of people that I know that have passed on because of COVID. But then one of them that really got close was a professor that taught me in pharmacy school in Ghana. He was a very great guy, and he died within like 4 days. Like it's that serious, right? Until, like you said, when you catch it, you realize that this is not a joke. Something that plays with your lungs is not something you want to play with. Like tuberculosis or anything, that has to deal with your breath. It's not a joke, right? But because a lot of people were recovering and all of that, if you have any form of protection, I think you should always stick with that. But then I know that a lot of people are dying. As we speak now in the US, every single day, at least 2,000 people die. That's a lot of people, right? And again, people say, well, people die every day. No, we call something baseline, right? You always have a baseline for the particular year. Since COVID came in, that has shot up. So that is an indication that COVID is contributing to the number of people that are dying.
And the other time I did a show on here, and one of the doctors was sharing with us that the number of people that COVID has killed within this short span of its hidden our world is more than, I don't want to misquote her, but she said it's more than a lot of the diseases, a lot of the pandemics that we've had put together. Again, don't quote me on this. You can do your own research, but I took a lot from what she said. Basically, COVID-19 within a short span has taken so many lives, man. People that are very close to me, people that I know. Dr. Melida is a good friend of mine. For those of you who know me, I know Dr. Melida. It took her husband away, and that for me kind of really got me. It kind of struck home. Felipe is the finest human being you would want to meet, and to hear that man passed due to COVID was very heartbreaking. But I'm just saying, some of these people. So I've had close friends that have suffered and recovered, thank God, but some also passed. Winfred, a guy that I know in Chicago, for those who know Winfred, great guy, he also passed. So we really want to encourage folks to look at the vaccine very carefully. You don't want to fall sick before you want to decide to do it. Okay, so just like we take the flu vaccine, please prevent it. Really, please prevent COVID before you catch it. And again, I'm not going to sit here and say and tell you what you don't want to do, but listen to what have been discussed so far and take a good decision. I took mine yesterday, and I'm proud that I did it. And I'm going to be taking the second one. As soon as the time comes, I'm not going to miss it. I'm going to take it because I know what I went through when I was sick. And I don't want to, again, go through the experience. A few minutes to 7:30, we'll try and end the show the next 6 minutes. We have been talking to the directors of the Ghana Community Health Clinic folks. And I mentioned that you provide blood work and all of that. Can you tell us what the procedure is? If somebody comes and say, I want to do a test for various things I'm experiencing in my body, Is that done, and how do you go about doing that? Dr. Fori, I know you have it. Dr. Eunice or Dr. Fori, one of you can take this on, depending on who. Okay, Dr. Fori, let's leave him.
I think I'll defer that to Eunice.
Okay, all right.
handle.
Okay, Dr. Eunice, he has been deferred to you, so I beg.
So blood work and other diagnostic services need to be ordered by a provider. So when you have your consultation with any of the providers that are working there, they will be the ones to direct you and order the specific labs that you need. So if someone's having a problem, let's say with anemia, we would probably order like a CBC, and try to monitor that person's hemoglobin. One thing I was going to say earlier when we're talking about services is that we have a huge platform of specialists. We have a urologist that's going to be making rounds. We have a pediatrician that is available to make rounds. So I just want the community to understand that this clinic is well-rounded and there is something for everybody. So don't think that if you come, maybe we won't be able to answer your question. Even if it's general medicine, Dr. HODOGBEY is qualified to answer anybody's questions, but we do have specific specialists that can be able to target and help you with any of your other needs. So we have lab services. We also have, that is with Dr. Chris with Medical SA Laboratory. He also owns complete diagnostic services. So we can do chest x-rays, echocardiograms, EKGs. I mean, now I feel like
you do all of this during the clinic?
Yes, we can do all that during the clinic, or we can arrange for the lab services and the x-ray services to be done in the comfort of your home. Wow. So this clinic is well ran. It's very unique, and I just want to encourage people, especially if you've been having like maybe isolated chest pain or anything and you just don't really know what's going on, coming to the clinic will give us an idea to really help you. We can be able to discover things that maybe could have harmed you in the future and be able to decrease your chances of having a heart attack or a stroke, and help you get down your cholesterol, help you manage your blood pressure. So I really want people to think about their own health today and think about things that they're going through and reach out to us, because we definitely are available and we want to see everyone feeling better.
That's very powerful. Thank you for sharing. Wow. So when is the next one? Before you answer that question, we have Rebecca. She says, great job, and a big shout out to you all. Thank you, Rebecca, for your comments. And Laura says, go Nancy. And Laura, thank you so much she says, that's my boss lady. Thank you so much, and Laura. The way Nancy carries herself, you don't know that she's a big boss, but she's a very, very big boss. Very laid back lady. Thank you so much for everything you do for us. Michelle says, very powerful. Thank you, Michelle, for your comment. And someone says powerful again. I trying to find out what message those two comments came for. But again, thank you guys. I don't know what this one is. Parkwest says, great show, Alinko. We thank all your panelists for sacrificing week after week in educating and serving the Ghanaian community here in Chicago. I don't know how they manage this on top of the daily work schedules and raising families. May God bless you all. Yes, that's a very great point. And to Pakwesi, you yourself, I don't know how you manage it. You are everywhere, managing your family and the Ghanaian community. You do an excellent job with that, I must say. And then even with the Ghana Fest. So kudos to Pakwesi also for trying to support everybody in the Ghanaian community as much as he can. And I know that a lot of people will attest to what I'm saying. This is from the Ghana National Council. Again, thank you to all for this great service to the community. All right, so in the next few minutes, we'll wrap up the conversation with the Ghana Community Health Clinic. When is the next one coming up? I would have Dr. HODOGBEY tell us that.
The next clinic is on February 12th, and is at the Presbyterian Church, the south side of Chicago. The flyers are going around, and if you need us to do anything before then, you can contact any of us. As Dr. Cromwell said, we have Dr. Oko, who does the OB and the gynae services for us as well. And I'm sure she mentioned this, that we have psychiatric services as well.
Okay.
So anyone with those problems can also approach us, and we will link that person. And I'm sure Dr. Cromwell mentioned this as well, but I'll echo that because that is very important to our community members. We also have a resource person who's helped to sign people up for health insurance in some form or the other. Because as Nancy said before, this is not unique to us, but it's actually more amplified in our community because we tend to live at several places at the same time. Therefore, our resources are spread thin. Healthcare, when you are sick and you are admitted, for the most part, that is the #1 cause of bankruptcy in this country. So if there are services like this, it is good to take advantage of them and have, because most of our people don't know that they are even qualified to get some health coverage. And we have that service available to our community. So approach us and we'll find ways to set you up to access the healthcare the best way we can.
Thank you. So, well, Nancy, we want to wrap up the conversation. I know the UAO provides, what exactly do you provide in terms of the UAO? What exactly do you do in terms of helping or partnering with the Ghana Community Health Clinic on a monthly basis? Can you tell us explicitly that, and what should people expect this coming month on the 12th of February?
Thank you, Alenko. As we are wrapping up, I just want to make sure that, we express our gratitude to the GNC and the Ghana House Incorporated for putting together this program, which is really needed in our community. And so really kudos to you, the team that makes this happen. For us, most of what we're doing right now is the vaccination. And so we encourage everyone, whether it's a first, second dose, or a booster, to come out and get vaccinated on February 12th. We'll be there from 11 to 3 p.m. I also want to say, right, that traditionally from where we come from, we only go to the clinic when we are sick. But we don't need to wait. Here we are. It's not cash pay as you go or anything. This is a service really being offered by the community for the community. And so we should all come out, check your blood pressure, get your medicine checked out for you, whatever that you need, come out and take advantage of this opportunity. Thank you so much, Alenko, for making this possible.
Thank you. My pleasure. Thank you so much for sharing. Last question, and then you can give us your closing remarks. Is there a progression in terms of the attendance since this is going to be this is the second month, right? I mean, you've had a second month, so we don't expect to see that much progression. But from the first month and the second one, would you say, in terms of the number of people, the attendance, have you seen, was there a progression, Eunice?
Yes, there was a progression in numbers, and more importantly, there were people who I believe their lives were more impacted. And that's what's more important to me. Yes, we want the numbers, and we want the numbers for a variety of reasons. One, we want to just help people. Two, it also is going to help us reach our goal to be able to eventually get a bigger clinic and be able to serve a larger population. However, as a healthcare provider, even if we can help one person manage their blood pressure, that's a huge win for us. And the meetings that we have weekly to prepare our health clinic, that's one thing that Dr. HODOGBEY always stresses to us, that we're not so concerned about the quantity, but definitely the quality. And so that is our goal. So we are excited and we are very willing and humbled to be able to take care of our community. I love what Miss Nancy said, the community people taking care of the community for the community. So that is just what we really, really want. So yes, we love to see more people coming there. We have lots of volunteers. We don't want our volunteers to be bored. All of our nurses and everybody else who comes to volunteer. So for sure, come there. But also know that no matter how many people are there, we always have the time to make sure that everyone is well taken care of. So if it's one person or 10 people, we're still the same.
Why is it necessary that people check their health consistently? Like simple things like blood sugar, blood work, what sugar rate? What? No, I'm sorry, sugar rate. No, sugar content. Wait, what's the term? I'm sorry, I'm not.
Blood
I'm
sugar.
like, sugar. What do you call it? What's the name again?
Blood sugar.
Blood sugar.
Blood sugar. Oh my goodness, man! I need some biology classes from Dr. HODOGBEY from Las Palmas. So, how important is it for people to check their health frequently? How critical is it, Dr.
I
HODOGBEY?
think the easiest.
No, okay, Dr. Eunice, go ahead quickly.
I was just going to say the easiest answer is prevention is better than cure.
Nice.
So preventative medicine is better than waiting till you get very, very sick and there's, so many things to be done and so many complications. This way you stay ahead of it. If you have high blood pressure, we can be able to prescribe you some medications, talk to you about it. And maybe in the next 6 months to a year, that problem would have been decreased or could even be eliminated. So that is the name of the game. Prevention is better than cure.
And it's open to anybody, right? Anybody can show up.
Yes.
Yes.
Okay. And do you, Dr. OFORI, do you give medications there, or you always advise people to,
Yeah. So as time goes on and we progress, we tend to collaborate with like industry and big pharma to help us provide medicines for free to individuals. Currently, what we do is we kind of help you secure the cheapest form of medication. If they're over the counter, we give you some coupons and things of that sort, so that your price at the counter will be cheaper. And also, most importantly, is we kind of reconcile your medication for you, which is something that a lot of us don't really pay attention to, which is you get a maximum out of the medicines that you take. So one of the services that we provide as pharmaceutical or pharmacy is medication management. So we reconcile your medicines and make sure that whatever you're taking, you get a maximum outcome from.
Wow, that's very powerful. People always associate African functions or anything Africans are putting together with food. So, but guys, don't get it twisted. This one is purely health. But anyway, let me ask though. They are here, Dr. Eunice, like Dr. HODOGBEY. Would you advise that people eat before they come? Because sometimes somebody comes and you do blood work, whatever, they might have to do anything that would hinder their. Is there any procedure that you guys may do that may have some body effects on people if they did not eat before they came to the clinic?
No,
No.
The short answer is no.
No, okay.
And the long answer is that we are not happy that Dr. Oko is not here, because she is our food advocate, and there's always food available. So,
really?
Yes, there's always food available, especially for our volunteers. I will get to them later on. But there's always food available. If somebody comes, we are advocates. So if you come there, we don't want you to be hungry going back. Yeah. So there's always food available. And that is why we encourage people to donate to us, so that can also be taken care of.
You can provide food.
More importantly, what I want to say is that you see our faces, mostly Dr. CROMWELL, myself, Dr. OFORI, sometimes Dr. Oko, and Dr. Habiba. But there are so many people behind the scenes who are making this possible.
Okay.
And we cannot mention all of them. The Ghana National Council for sure, the president, Parkway Sisam, and the GHI chairman, and Mr. Timpo, and the vice, Mr. Bashiru, And then all our volunteers, if I start mentioning names now, I will offend somebody. But we have very, very dedicated volunteers who have started with us and have been showing up every month, and we can't thank them enough for what they are doing for the community. So our thanks go to all our volunteers, and we encourage more health care workers in the Chicago area, especially from the Ghanaian community, to join us to serve the community.
Awesome. Thank you so much. The Ghana Health Night, the Ghana Community Health Clinic,
Yes.
serving humanity through healthcare. Very powerful. Every month. Coming month is the 12th. It falls on a Saturday, I'm guessing.
Yes, the second Saturday of every month. So
Second
if you
Saturday.
forget the second Saturday of every month, we are going to be available.
Okay. Ghana National Council is known for great initiative. We know the Ghana Fest last Saturday of every July, and now we have the second Saturday of every month. It's free health clinic. Anything, it doesn't matter, just come through. From psychiatrists to gynaes to pharmacists, family doctors, everything. Urologist, you mentioned that, Dr. Ofori. So for all the people who are interested in buying Viagra, but you don't want to take the vaccine, which is produced by the same company, now you've heard it. If you can
remember
buy,
that part.
why wouldn't I remember that part? Last month, well, for those of you, a lot of you don't know, but Las Palmas, Dr. HODOGBEY goes by Las Palmas. We went to the same high school together in Ghana. It's called Maoli Secondary School, founded by a Chicagoan, Reverend Trost.
Maoli School, please.
Yeah, Maoli Secondary School, right?
Maoli School.
It's not second. Okay, Maoli School. The secondary has been taken away from it.
Taking that away. Yes, we don't like that.
You don't like that? Okay, so Maoli School. But yeah, he was. Palmas, were you 4 years ahead of me?
I was in Upper since when you were in Form 1. I was that.
Oh my God! See, he likes to emphasize that. He was the entertainment prefect. Okay, he was the entertainment prefect. Very, very lively. He's always been a lively guy. And so yeah, so we've been knowing each other for a long time. He wasn't one of those seniors that would, unnecessarily punish you and take you through all types of, torturement, we used to call it, but yeah, we've been knowing each other for a long time. Great guy, and I'm glad that, after so many decades, we found ourselves in the same city, doing community work. And I guess it speaks to the core and heart of Maoli School. So if you were ever looking for a high school in Ghana for your kids, remember Maoli School. Okay, these are two great products you're seeing now. All right, that was just by the way, but we are glad that we were able to go through this program. We would want to thank my I want to thank my guest, Dr. EUNICE CROMWELL. Your dedication and passion for the community is out there. It's unmatched. Everybody sees it. So kudos to what you do. Thank you for your heart. Nancy, I'm not going to mention the middle one because I don't want to mess it up. So that's Nancy Autry, the director of UAO, United Africa Organization. Thank you so much for being on the show. Dr. Ofori, Dr. Edward Ofori, pharmacist, researcher, professor, all of that. Dr. Ofori, Dr. Prince HODOGBEY, thank you for coming. I'll have you give us your closing remarks for this particular episode. And I want to start with let me start with from the top and we'll come all the way down and end with my senior man, Las Palmas. Dr. EUNICE HODOGBEY, Dr. EUNICE CROMWELL, please.
Thank you. Let me just first thank you, Alenko, for putting up this wonderful program. We truly appreciate all the work that you do in the community as well. And I'm grateful for the opportunity to sit here and talk about the Ghanaian Community Health Clinic. Again, a very good initiative, and I really want people to take advantage, come out, get assessed, so we can be able to help as many people as we can. So thank you.
Thank you so much. Nancy Autry.
Thank you again, Alenko, for creating this opportunity for us to be here. Just for everyone, remember that our health is more important than anything else, and so we should make that our priority. Most of the time, our busy lives stop us from thinking about our health, but come out. February 12th is the next one for the Ghana Health Clinic, and we hope to see you there.
Awesome.
Thank you, everyone.
Thank you. Thank you. And it's going to be at the Ghana Presbyterian Church. Is that what it is?
Yes, near 84th and Cottage Grove.
Okay. 84th and Cottage Grove. We'll put the numbers out, that information, where you can get more information from. We'll put it out there in a bit. Dr. OFORI.
All right, so I'd like to thank you and the listeners, the wonderful listeners who listened to us this evening. We only carry one message, and the message is that we want to promote good health among our Ghanaian and African community. So part of the reason why we've established this organization of Ghanaian the Health Clinic every month. So please come by, stop by, and come have your health checked. And also, if you haven't got vaccinated against COVID, please do. Thank you.
Okay. Just to clarify, I mean, just so I get it. I mean, for some people who are listening, you mentioned Ghanaian community, African community. That's the prime target. But of course, you're open to anybody from whether you're Caribbean, Latino, African American. You can all come through. Is that correct?
Correct. That's
all
correct.
Right. Okay, Dr. HODOGBEY, please. Dr. Las Palmas HODOGBEY.
Yes, Alinko. Yes, thank you so much for putting this together. And I want to apologize to you in particular because you have tried several times to get me on this program, especially about 4 years ago when you started.
Yeah.
But because of time and everything, I wasn't able to do it.
Yeah.
But now, because of Ghanaian community thing, I couldn't give you any excuse anymore. so you have found a way to get me to the program through Dr. EUNICE CROMWELL. At the time I got to put things together, Dr. CROMWELL was 2 or 3 steps ahead, as she always does. And we have to thank her enough. She is the glue to what we do. We cannot thank her enough for the services that she provides to the community. So I thank everybody, the volunteers and everybody, and nobody works harder than her to put us together and put us in line for what is happening in the community now. And we look out for greater things to happen. Our short mantra for Ghana Community Health Clinic is health is wealth. We can't stress that enough. If you are not healthy, there's no way you are going to accumulate any wealth. So we want to encourage everybody to participate in what we are doing. And we thank you for hosting us. And we thank all your audience for listening to us.
Thank you very much. I am very honored to host you guys and get this information out there. Health is wealth. Really believe in that. That's very powerful. Remember, I just want to remind our audience that February 5th is when we had advertised that we're going to do the exchange ceremony at Rainbow Push. We had to cancel it due to the Omicron variant, and mainly because of that. It was going to affect attendance, and a whole lot was going on last month during our preparation, so we had to cancel that event. It's going to come off this year for sure. We're looking at somewhere May or June. Stay tuned to the Progressive Minds platforms. We'll be putting out the info out there, but the exchange ceremony is definitely coming off this year. Again, watch out on our social media for more information. Again, want to announce that we're going to have a co-host starting from next month. And because we want to move, want to grow, want to do this better, we want to impact even more. So we are excited that it's not going to be just Alinko, it's going to be Alinko and a co-host, and we're going to be announcing that as well. Again, again to my great audience, thank you for chiming in, for being part of the show. If you want more questions, I want to follow up or get more details, you can go to the Ghana National Council social media platforms. I'm sure they have this information out there. If you reach out, if you go on Facebook and you look up Dr. EUNICE CROMWELL, she is the face of Facebook. You can't miss her. Dr. EUNICE CROMWELL. You can't miss her. If you go on her page, you can ask any question that you may have missed or recommendations. She's always available to help. Or if you look up United African Organization on Google, you can call them, ask for Nancy or Stella, any of the people there are more than happy to assist you. Dr. OFORI is also on social media. I think Facebook, Dr. Edward OFORI is also on there. Dr. Prince HODOGBEY is what I'm not too sure. You know, he's old school, so his Facebook pages, social media.
Hey, Alinko, I'm not that old school. I'm just social media shy.
Okay, you see while he's countering that. When I said we went to school together, he was quick to remind me how far ahead he was of.
That's not old school. 6 or 7 years is not old school.
It's not old school, Abi. Okay, I hear you. No, Dr. HODOGBEY is also on Facebook. Point is, you can't miss this. February 12th, 84th and Cottage Grove is where it's at. The name of the building is the Ghana Presbyterian Church, right?
Yes.
Yeah, okay, simple. Ghana Presbyterian Church. You can't miss it. February 12th. Keep that date in mind. Tell a friend to tell a friend. Okay, this is very good. It's free. You know, it's free, and let someone come through and get their healthcare taken care of. Well, on that note, we would like to thank everyone that has been part of the show this evening. Remember, to whom much is given, much is required. Being your host, Alinko, and we shall be here next week. We'll be talking to the director of one of the directors for United Airlines. You know, they fly straight to Ghana now. There are more things in there we want to share with the community. So stay tuned. Next week, Wednesday, 6 to 8 p.m. We will be here bringing you one of the directors of United Airlines on the show. Well, on that note, we shall see you. Have a wonderful evening, guys. Bless you all. Take care. Have a good night.
Thank you.
I know you are going home to some Akpala and all of that.
Yes, it's already waiting.
Oh, no. Dr. Eunice, have a good night. Thank you for helping out, Dr. Eunice. I really want to thank you for hooking me up with that appointment. Just that I just couldn't wait. You know, I just couldn't wait. I wanted to.
I'm glad you went and got it.
Yes, I wanted to get it. So, thank you for helping. And Nancy, say hello to all the crew at United African Organization. Love you guys.
Thank you too. Thank you, everyone.
Spread the word. Thank you. Spread the word on the vaccine.
Bye.